Healthcare workers in the Cayman Islands really haven't had to deal with a whole lot of COVID cases, unlike the rest of the world. So I thought it was really important to bring on frontline healthcare workers who, in fact, are definitely dealing with it. They shared their experience, and I picked out a few memorable moments from the show. I do really want you to watch the entire show, which is available on the Cayman Mall Road Facebook or YouTube page. But here's a sample of what was said on the show.
So first, I've seen countless. I mean, I can't even begin to um, estimate how many patients just this hospital alone I have cared for, let alone the patients that I cared for in Massachusetts, North Carolina, Miami, California. It's countless. But when I say I have not come in contact with a single person in the hospital who is hospitalized because of the effects of the vaccine, it hasn't happened in my experience. So I think we have to be very cautious. What we listen to. We have to think
Mm-hmm.
critically about these things. We have to say, okay, does this seem within the line of reason? First and foremost, don't even concern yourself with data. Let's just say first, does this make sense? But then after that, we do have to look at the data. We have to look at the numbers, and we have to say, okay, if this many people have been vaccinated, and you're truly not seeing the data that supports the severe symptoms, all these things that we're hearing, we have to really take a step back and say, okay, maybe this is just people touting the misinformation, the drama
Mm-hmm.
of it, the theatrics of it. Because much like rumors, as we all know, that information is more salacious and it spreads far faster than the truth would.
Something that I think about being in the States and knowing the resources we have, I think of my family. I have family from the Bahamas and Belize, and I know that we don't have the same resources back home that
Mm-hmm.
we have in the States. And that's just something that I definitely tell the people in the Cayman Islands to think about that. Like Asia said, she
Mm-hmm.
traveled across the country. There were resources that they could pay these nurses to go places, but who's going to come in? Who's going to come in and save the Caymans if it gets to that point? And you
Yeah.
don't want it. You
Right.
don't want it.
If when we go on a jet ski in the sea, we put on a life jacket, even though we
Mm-hmm.
can swim, right? Why do we do
Mm-hmm.
that? For added protection. The
Yeah.
vaccine is that protection. So get the vaccine.
And one of the questions I got for you, Asia, I mean, you're seeing those most critically ill patients, and there's a lot of people who are out there, obviously throughout the USA and in Cayman. Even though they have a good you heard the vaccination percentage. We have a much better percentage of people who are fully vaccinated, but there's still a ways to go. It's not where it needs to be. But tell me about the type of patients that you have in your ICU. Are they typically vaccinated or unvaccinated?
Currently in our ICUs, and just to kind of give you a perspective, I work in a large hospital in Tampa, Florida. We currently have, and I'm literally in my office across from three of the ICUs. Just in the ones across the hall, we have about 70 beds just on this side of the hospital alone. Out of those 70 beds right now, about 40 of those are COVID patients. If I think about the hospital as a whole on this side, it's about 40 patients. Um, a large majority of them are unvaccinated. For the ones that tend to be vaccinated, the issues we see with them getting admitted to the ICU are more so those with other comorbidities like immunocompromised people who are on chemotherapy, those who are on like biologic medications for rheumatoid arthritis or lupus and things like that. But the large majority are patients of every age that you can think of. Unfortunately, just yesterday we had a 35-year-old pass away. I came in today and I was informed that we had 9 deaths today, and the evening isn't over. And that's just in the ICU. So unfortunately, this does take, especially with the Delta variant, it takes a large toll on those who in the past we didn't think would be affected as severely. But this Delta variant is slightly different. And to touch on that, I mean, a lot of people don't understand why this is different than anything else. But with any other microbe or bug or offending microbe, they mutate, so these viruses, they become better at replication, they become more efficient in protein binding. So as they evolve, it becomes easier for a person to become infected. The microbe can stay around in your body a little longer. It makes you sicker, and the Delta variant has done just that, and it has proven to be even more deadly than we could have expected when COVID first hit, which is why vaccination is so very important. So very important. It's the single most important thing we can do at this point to get this under control.
And I'm a certified lactation counselor, and I would say that yes, it does. Those protections pass through the breast milk, and it's definitely an added benefit for the mommy and the baby in the long term. But just how someone was asking the long term symptoms, COVID from a nutrition standpoint can be devastating just with how it deconditions your body. You just get so weak, you just really don't have the energy that nutrition wise, it does have a long term effect with all the weight loss and everything else.
So
Yeah.
Danielle, you want to just kind of go in and why nutrition is so important with someone with COVID or even before they get COVID as well?
I think it's nutrition. I think of it as a fuel for the body, that it's just really important to just try to give your body the best chances possible to make sure your immune system's as healthy as possible. I think people try to hold on to their hope that if I take these mega doses of vitamins, it'll really get me to that point. And they might try to rely on that natural side of things versus the vaccine. And sadly, there's no data that shows that mega dosing is really going to help them. So the vaccine on top of just building a natural immunity is really what's going to be helpful. I had a patient that the stuff that holds on to you in her final days, not knowing it was her final days, was asking for an anti-inflammatory diet because she thought or she read someplace that if I could take a diet to help me fight this inflammation, that's going to be my saving grace. And the nurse, right before she passed, one of the last things she said to the nurse was, "Please hold on to my grapes. Don't let them take my grapes." And the nurse said she came out of the room and she's standing there with the grapes, like, "What do I do with this?" And it's things like that that stick with you. So I think for all the frontline workers, it's those little personal stories that really hurt. And as much as I want to say as a dietitian that we can eat our way out of this, we just really can't. It takes a lot of process.
Some people say, well, it was developed too quickly. And I combat that always by saying, but at the time that this created, we had all of the greatest minds in science and medicine all committed to one thing, and that was coming up with a solution to this pandemic. And so when you have the greatest minds all working together for one common goal, you're going to come out with something that's going to be it did come out quickly. However, it was vetted. It went through multiple clinical trials with tens and hundreds of thousands of people. So we can't discredit the fact that, yes, it may have seemed like it happened in the blink of an eye, but literally it didn't. It didn't. When I was working in Massachusetts, I was a part of the remdesivir trial. It was an awesome experience, but like I said, it had the greatest minds in science that were all moving full steam ahead at coming towards a solution. But unfortunately, there is that medical mistrust that exists. And kind of also that was mentioned, I think that there are some political ties that kind of led to where we are, and that kind of has led to where people are not trusting the process, not trusting the science or the data, which is unfortunate. But as healthcare providers in whatever area we work in, I think it's very important that we help people understand the data. We understand it, but a layperson doesn't. So we have to explain to them how the vaccine works. How does it prevent those severe COVID symptoms, and how it works is to benefit our community as a whole. It's our responsibility as healthcare providers to educate our community and kind of help give them the comfort that they need sometimes to make the decision to get vaccinated.
Have you seen an increase in interest for people trying to enter school to be trained to become a paramedic or a healthcare worker under your program?
It's almost kind of twofold. Yes, there is. The ones that are getting into it are definitely there because that's what I want to do. And then we have some that are going, nope, not for me. I'm going to go business route. I'm going to go underwater basket weaving, whatever. But I don't want to be near sick people where I could die. And trying to convince them, okay, yes, the COVID is bad. Hands down, it's bad. But we have a vaccine. Now, granted, vaccine's not 100%. You're still getting COVID. Look at me. I got COVID. But you know what? I had a cold. I took my antibodies. I slept for 2 days. That's my experience with it. 6 friends of mine have died, but they were also unvaccinated. And I try not to, because in teaching we can't bring in our political or personal feelings, but trying to use it as a teaching point to go, we've had vaccines for years. That's why we don't have smallpox, and that's why we don't have polio.
Exactly.
Use a little bit of common sense.
Let me know if you have any follow-up questions. You can connect with me on Facebook or Instagram at PIOKevinW, or you could WhatsApp me at 407-267-8402.